feeling for lumps.
Yes.
You're feeling for things that are hard, like nutmegs. But if you find something, first thing is you don't panic.
I had a kebab knife through that hand.
Yeah.
Took my knuckle off.
Kebab knife, did you say?
Kebab knife's worse than a dog bite and a human bite.
Jeez.
I don't want to be, abnormal person. This is better if I go with my sickness and die one time.
So you've submitted a urine sample?
Yeah, urine sample, yeah.
But it was meant to be a poo sample.
Poo sample, what is...
So you need to poo. That's where all the problems started.
And you talked about feeling suicidal. What is it you thought about doing?
Just, like, chucking myself under a train.
Would you like to see a doctor?
Yeah, I phoned up and booked an appointment.
OK, what's your name?
Spiritual Park.
Surgery Stacey speaking. Sorry for the delay. How can I help?
Why do I have to do... Oh.
Because it goes out every 3 months.
Why doesn't it warn me that
It probably does, actually.
No, it doesn't.
Well, just put it in again.
OK, well, you have got a locum, but you're on the system. Yeah, you're on the system, and there's 1, 2, 3, 4, 5 patients waiting. Oh, bloody hell. All right, then. OK, bye. OK.
Next available.
Move these over to Ferdy.
Spencer?
Sorry.
That's all right.
I'm so glad to see you.
Why is that?
Bloody marvellous last night.
What was I? What happened to you?
Beat me up Monday or Sunday, broke my ribs, and one member of my family, I won't say his name, hit me because he thought he could do me with bad ribs, so he knew I was vulnerable. And the hospital gave me codeine last night, and because I'm on Subutex, I can't take codeine. I'm sorry, I can't breathe properly.
Yes.
I don't like to lie.
That's all right. I appreciate you not lying. You've been to A&E a lot recently, haven't you?
Yeah, I have.
Good morning, Sir John's Medical Centre. Sarah speaking. How can I help?
I think everyone's waiting like 45 minutes out there. I'm going to get lynched.
Good girl. Let me just move that chair and then you can reverse into this spot.
Right, push up with that hand. OK? Yeah. See if you can do that every time you get in and out of bed. Are you all right?
Low. Keep going, keep going, keep going. Push, 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 push. Go on, you can do it, you can do it, you can do it. You're gonna kill me, you. Oh, dear. That cleared your chest, didn't it? Right. When you do stand up and things, do you get short of breath with that?
Well, do you know what? If I was to tell you something, right, you wouldn't believe this. I'm no better off now for giving it up than I was when I was smoking. I've got more problems now. I've got high blood pressure.
Oh, have you?
Yeah, which I never had before.
Well, it's
my cholesterol always goes through the roof. Every time I give it up, I end up with more ailments than they do if I'm smoking.
But just think how better you'll feel in, like,
well,
another
the
year's
money's a lot
time.
better.
Yeah, exactly. You got some more dosh in your pocket.
Yeah. I get out and about, because in the winter I don't go out as much as I do in the summer.
No. Mind you, if you had a better wheelchair, you might get out a bit more, mightn't you?
Yeah, well, sometimes if I had a better carer. He's nearly tipped me out the wheelchair on the way here. Him. And standing there laughing, pushing the trolley.
Now you're a young man.
Mine is very high, dude.
Get out of it, you're a bloke.
You know
Oh dear.
Shortness. Yeah, you can go to the pharmacy and buy some stuff there to get rid of them. You wouldn't really need to see a doctor for that.
I've been getting breast pains since the car accident now.
Yes.
It's become more predominant with pain, more sensitivity, and it's more my right breast more than my left.
Right. I think we probably ought to examine your breasts today.
Yes, please.
Don't you think? You'd have been here quickly if you'd had any lumps, wouldn't you?
I would have been, or I would have gone to A&E if you wasn't here, so I would have definitely acted upon it straight away.
You would have gone to A&E?
If you wasn't here, yeah.
Don't go to A&E.
All right, fair enough.
How long have those doctors been qualified in A&E?
I don't know, not long probably.
Exactly. How long have I been qualified? Ages.
25 years as I've known you, and
Yeah.
I don't know what other on top of that you've had.
What I'm saying to you is, if you did feel a lump, phone the surgery and you book an appointment. You say, I want an appointment as soon as possible, and then they'll fit you in.
Okay.
As long as you're seen within 48 hours, if you've got a lump, that's fine.
Okay.
I just need to look in your eye.
Please don't at me.
Look straight ahead at me. Good. Lucky boy. The eye's going to be all right.
Oh, look. That's not my knockout punch. It's my left hand.
Yeah, well, you're holding that a bit carefully. Is that giving you a lot of pain?
My knuckle's back. I had a kebab knife through that hand.
Yeah.
Took my knuckle off.
Kebab knife, did you say?
Yeah, went through there.
Yeah, I can see it.
An enemy, believe it or not, jumped over in a kebab shop, pulled the kebab knife out. I jumped over the kebab counter and tried to grab it off him. I didn't know that was double-bladed.
Yeah, they're sharp.
Kebab knife's worse than a dog bite and a human bite. I've got so many scars, doctor.
Yeah.
There. More.
Yeah.
More. But I'm a nice guy.
Right.
I'm sorry.
You can take things like ibuprofen, can't you?
I've got ibuprofen, they're bloody shit.
Yeah, this is stronger than ibuprofen, but it works in the same way. It should help to manage your pain a lot better.
Okay, when I saw your face, I was bloody happy.
Good. Well, I'm glad, Spencer. All right then, Spencer. Take care.
Right.
All the best.
Thank you very much.
No problem. Bye-bye.
You're looking at the nipples. Which way are they pointing? Make sure they both go in the same direction.
Okay.
You're not got one pointing upwards and one going downwards. Then you haven't got any nipples that are going inwards.
No.
And you haven't got any what we call dimpling on the skin, so that's a sort of bubble or dimple. Brilliant. OK, you've done very well. Now let's have you lying down. So once you've done that, then you proceed to the feel bit.
If I'm examining a lady's breasts, I'm hoping I'm not going to find anything. But clearly, I've always got to be on the lookout for something sinister.
But basically, your right hand will feel your left side and your left hand will feel the other one.
If you've got to break bad news to somebody, the secret is to always give them a little bit of hope and to break it in little pieces.
And you're feeling for lumps.
Yes.
You're feeling for things that are hard, like nutmegs. But if you find something, first thing is you don't panic.
Patients who are waiting to see Dr. Corrali, would you like to come forward, please?
OK, so you have an appointment booked for today at 2:45 and you want to cancel it. OK, I'll cancel that. Thank you very much for letting us know. That's by 2:45 cancellation, Dr. Savage. You all right, Ferdy?
In everybody's breast, we always find that there's a little bit of breast that creeps up underneath the armpit. It's called the tail of the breast.
Just a little bit of sensitivity under there.
Yeah. You're doing so well. It's very, 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 very good. Very good. The last little bits around the top here. Okay. Well, look, good news, there's no lumps.
Good.
Have a tissue. That
I'm
was
just
difficult,
really
wasn't it? Oh,
That's all right.
look,
It's okay.
You're being a really brave soldier because having had that accident's made you, shaking you up, it's made you feel really vulnerable, hasn't it?
It has indeed.
I think that knowing your patients is really very important as a GP, because with the time constraints, you've got to decide very quickly on in your consultation whether what that person is coming in complaining about is something very serious or it is something not so serious. Sometimes you don't get it right, but you've got to make decisions.
Okay, so what do you think?
There's all sorts of explanations for this.
Okay.
Could be a hormonal blip,
Mm-hmm.
which has been made worse by the shock of the accident.
Mm-hmm.
If you know your patients and they come in and they look desperately thin, or they look pale, or they look worried, you know that they didn't look like that the last time they came, and so there must be something wrong.
It could be part of the general shake-up. That could be what's making it worse, okay? But at the moment, I don't see any reason to refer you to the breast clinic.
Okay.
Yeah, I've looked at you now, give you some anti-inflammatories, and we'll make a point of revisiting this in a month's time.
Okay, that's fine.
You're happy with that?
Absolutely happy.
Good.
Good. Thank you.
Okay. Hi, Jane.
Hey, baby, how are you?
I'm fine. Can't take a seat for me. What are you doing?
You changed your room. You're moving around, woman.
When did we have one done? Yeah. Okay, not to worry. So you get yourself ready for me, okay? And how you been, James? How was your weekend?
All quiet, watched all my sport, the cricket, the football. Yeah, I love me cricket. I want spring to come because I got that discount rail card I paid 30 quid for. And I get a day down the coast. Half price, see? Get a good weather, I can go to Brockley, change at East Croydon, go down to Worthing. I like Worthing.
You like Worthing?
Yeah, nice.
Well, I like Margate, but...
Margate?
Yeah, our friends live in Margate.
Yeah, that used to be the bee's knees, you know.
I know.
Margate, Ramsgate.
Right, relax this down.
Yeah. Oh, you are gentle, darling.
Right, there you go. All done.
Now, don't forget me blood pressure, darling.
You want your blood pressure done as well?
Yes, because I think you've put it up.
Hello, how can I help?
Can I just collect up a prescription for me, Stephen Harmon?
Harmon, yeah?
Yeah, how are you?
Yeah, I'm fine. Rest of the family okay?
Yeah, not too bad, thank you.
Good. When did you put your request in?
Come in. Amanda, how are you?
Never say never.
What is it that I can do to help you today?
Right, well, I didn't realise I was low on my tablets as I thought I was.
Right, OK. So this is mainly a visit to grab some tablets. I'm very confused by your medication list. So I was just thinking maybe we should just quickly fire through it and try and figure out what you are taking and what you're not taking.
I take all of it.
No, I know, but I think there's certain things on here which just... I just want to check. Make sure we're giving you the right things, right?
The amitriptyline apparently should be helping what I've got up going on the top of my neck, and I'm under the physio at Lewisham as well.
Good. How long have you been on the amlodipine for?
Quite a while now, because they've actually put me on another little one.
Is that the bisoprolol?
Yeah. And have they put the morphine on repeat as well?
Well...
Because I've been on it long enough now for it to be on repeat.
Well... Question is, do you want to be on morphine?
Well, no, I don't, but it does help with the pain.
Funnily enough, as a doctor and a GP, I don't want to give out medications to people. I only really want to use them when I absolutely have to.
My body's getting used to the 20/10, that's the only thing. And I know it can go up 2 more times, but I've got this big row with the job centre at the moment as well. They're trying to get me to go back to work, and if I don't find something or tell them that I want something, they're going to sanction me, which means I lose my money.
Right.
Which is not fair on me, because I know that I'm never going to work again.
because when my hands are bad, they're bad. It's enough to just try and make a cup of coffee, and then she sits there. But oh look, I burnt myself over the weekend. I said, we're not talking about you. We're talking about me.
Okay.
When I first had pneumonia years ago, back when I was about 40, I was working for Iceland, and I was in and out the van. And you put the big coat on, you get chilled because you're carrying all these heavy bags. So I'm sweat. Got pneumonia then.
Well, some people who end up in those sort of situations, get colds, etc., they don't get pneumonia. There must be something making you susceptible to pneumonia.
Well,
what do you suppose that is?
I haven't got a clue. You
really?
tell me.
You don't know.
I'm tired. I've only had 4 hours sleep. I had a bad night last night.
A lot of the problems that my patients have can be dealt with other things like exercise, diet, giving up smoking, not drinking so much. Those are the things which actually I need to be influencing and giving advice on in order to really improve the health of my patients.
How many are you smoking?
I've given up.
Have you given up?
Yeah. And this might smell of smoke.
I wasn't aware, because last month I think we got you down as still smoking and...
No. I think I might have had the odd 1 or 2, but that's it. Because they kept saying to me in hospital, give up. I said, I've given up. What's wrong with you people?
Okay.
I've just done it pure willpower.
Good. We'll see what effect the tablets have had on you, but it needs to be 3 months down the line.
Right, okay.
All right, Amanda?
Thank you very much.
No problem. All the best.
Wreck the joint before I go out.
Bye-bye. Take care.
Good afternoon, St John's Medical Centre. Sarah speaking. How can I help? No, Orlean, I don't have anything else today now. It's booked for you at 3:10, but I can't make it any earlier.
Hello, Mr. Gulai. Good to see you again. Please take a seat. Sorry I'm running half an hour late today.
Yeah, so...
What's been happening with your symptoms? Because you had quite a bit of pain, burning sensation after eating, acid in the back of your throat, worse when you lay flat, worse after alcohol. Is that all kind of, am I remembering correctly?
Yeah.
Great. And that all sounds to me very much like acid.
Okay.
I think you had a few concerns that it might be to do with your heart, but I hope I put your mind at ease. There's one thing I wanted to do, was I wanted to get the stool sample.
Yeah.
Okay?
Yeah.
To make sure there wasn't a bacteria that was causing the symptoms you were getting. But what happened was you submitted a urine sample.
Yeah, urine sample, yeah.
But it was meant to be a poo sample.
Oh.
So the urine sample, that didn't help.
Oh.
And then you didn't pick up the prescription.
Yeah.
So we kind of haven't really moved on as I would have liked to.
Okay,
but it's not a problem.
All right. So I don't need to fast for this one, huh?
No. This is just a poo sample.
Yeah.
But
what is poo sample? What's that? It's poo.
So you need to poo. That's where all the problems started.
Okay.
You gave me a urine, a pee sample.
Yeah.
But I needed a poo sample. Okay, a stool sample. So yeah, feces. That's what we need, because that can tell me whether there's bacteria in the stomach. Sorry, I wasn't making that clear.
Okay.
All right,
No
so
problem,
that's the key. That's the key. I'll be upset if we get another urine sample.
No.
Blue for poo. Easy to remember.
Okay.
All right.
What's his date of birth, please? And is this rash just come up where?
I mean, I can do a letter for you that says about the fact you've got epilepsy and about your other conditions as well. And then you talked about your mood. Tell me more about your mood.
I've been feeling really depressed lately because of a lot of personal issues. Everything that pretty much could possibly go wrong in my life has. I've been feeling kind of like suicidal at points as well. And just sort of like come home and like cry every night pretty much, and not feeling sociable at all. Don't really like go out, and I just feel like really down.
And then what specifically happened? So you said that there've been some things happening, but what's happened?
My granddad died, and
I'm sorry to hear that.
my brother was stabbed. My mum and my stepdad are getting divorced. and plus my boyfriend also is in prison as well, so that's quite stressful. And just sort of, I feel like I'm under a constant battle with like my sort of conditions and stuff. And like I just feel so worried.
You talked about feeling suicidal. What is it you thought about doing?
Just like, because I just don't see the point of going on, because I just don't have no one there for me at all, just to comfort me even. Not even, because I'm not really much of a talker anyway, just to like have that bit of comfort, you know, just to have a hug and say everything's going to be all right kind of thing. And so just like ending it really.
What is it you thought of doing to do that?
Just like slitting my wrists and just like chucking myself under a train. Okay.
How's your sleep?
Not good. I've never been a good sleeper anyway, but there's not really a lot I can do about it because of the medication that I take for my epilepsy.
When you talked about feeling suicidal, would you ever act on these thoughts? Would you ever act on those thoughts?
No, because I'm not a selfish person, and I know that I'd cause a lot of hurt to a lot of people if I'd done that.
Because it's important, if you are feeling suicidal, that you need to let us know or someone else know, because we don't want to see any harm coming to you.
Yeah.
Yeah.
No, I wouldn't do that because I'm not a selfish person like that. I wouldn't do that to them.
Have you suffered with depression in the past?
Yeah, but like not on, like, you know, bad things have like gone on, but you know, it's just not onto the degree that I feel at the moment.
We can refer you for counselling here if you want.
I've never been a great fan of counselling because I'm quite a private person. Like I said, I'm not really much of a talker. I can take everyone else's problems on board. Like, I'm a great listener, and I could just sit there for hours for someone talking to me and listening. But I don't really like the idea of just talking to some random person.
And have you thought about anything like antidepressants or medications? Is that something that you've thought about?
Yeah.
So one of the theories behind when people get low in their mood or depressed is that one of the chemicals in the brain is low. So antidepressants help to boost up that chemical. Quite often, you have to take them for at least a month before you might see any benefits of taking the antidepressant. You can get side effects. Common side effects with antidepressants tend to be nausea, vomiting, stomach upset. Some of them can cause problems with vision as well.
Okay.
Antidepressants, I wouldn't say that they're a long-term solution. I think they can be good to help get people out of a rut as such, you know, in combination with other things as well, because you've got to look at different life aspects, and if there's something that's making someone feel depressed, to deal with that as well.
I guess it's something I can try.
Yeah, are you wanting to try one?
Yeah.
Yeah.
Quite a big proportion of our patients that will come in with, you know, either depression or feeling low in their mood or anxious or in a distressed state as well. On a daily basis, I might see maybe 5 or 6 patients that are going through some sort of form of distress.
Because of the other medications you're on, I just have to double check about what we can give you.
Okay.
I'll get back to you at lunchtime today.
Okay.
All right then.
Okay, thanks very much.
All right, good to see you again.
St John's Medical Centre, Sarah speaking. How can I help?
Hold on, I can't. I need some more details. Could you tell me what the symptoms are, please? She's
coughing. So she's got a cough.
Just breathe normally. I'm listening to your heart. Okay, good. Chest is nice and clear. Your heart sounds normal. The first thing to say is you don't need antibiotics.
Okay.
What you have is a cold. So it's a... It could be flu, but even if it's flu is caused by a virus, and antibiotics don't work.
You haven't got no antibiotic I can take for sore throat?
Nothing, it wouldn't work.
Really?
Yeah, the sore throat's going to get better on its own in 2-3 days.
Serious? No antibiotic? That's what I've come here for.
I'm afraid I've got bad news for you. Cough can last 10 days to a fortnight at least. Giving antibiotics doesn't help the cause. No antibiotics for the moment. Self-help, steam, lozenges.
Okay.
But I haven't got any magic wand.
Just say, wow, that is pretty clear cut. So that tonsillitis is so bad, you definitely need antibiotics. I mean, that's a clear cut case. So if any one of your friends asks you, doctors don't like to give antibiotics, that's the kind of classic case where you need antibiotics. It's pus, it's very swollen, your glands are clearly up. If those tonsils get any bigger, like if you actually find that you get a kind of ooh, that kind of noise, any hint of a noise like that, you have to take yourself down to A&E.
Does the fact of smoking affect it?
Smoking's not going to help it one bit. Had any thoughts about quitting smoking at all?
Yeah, I tried it for a week.
You tried it for a week? How many would you smoke a day?
20 a day.
20 a day. Before you're 30,
yeah.
If you just stop now, that's £26,863.
Yeah.
How much pleasure does smoking really give you?
Calms the stress.
Not as much as a £26,000 holiday, all expensive paid.
Yeah, but that's like in 10 years. So.
Well, but it's still real.
Great. Got a gap. Woohoo. Somebody not turned up. Marvellous. Perhaps I can grab a coffee.
I'm going to go and eat some cake now. Bit of gattox.
I can help you today, Dwayne.
My mum passed away last year, February. I hadn't really grieved. I ain't seen counselling or breathing classes. I just haven't got time, to be honest, and that's me being honest. And I've got to be strong for my kids. I come up with some little rash just before Christmas, and I'm trying to keep my stress levels down, but my armpits are sore where it's flaring up there now. Crease my arms, it's sore. My neck is sore, my face is sore, and that is stressing me out because my eyelids are getting itchy and sore. But my face has taken a piss. That I'm going to get stressed because it's really tender now.
Yeah. Okay. Do you want to pop your jacket off and let's start by having a look at your arms?
I've never suffered allergies. I don't know what's caused it. I don't think I've dealt with stress since I was 8. My mum's had asthma, diabetes, high blood pressure, blood clots, arthritis, and rheumatism. I've dealt with stress. I've never had nothing like this. It's already sore, especially this part of my belly.
Yeah.
It's like it's inflamed, and I don't know what it is. My friends keep telling me it's not psoriasis, but I don't know. I've never had skin allergies.
Yeah, so there's different types of psoriasis that you can get, and where you get the big flaky bits, that's called chronic plaque psoriasis. This looks like a slightly different version of psoriasis.
Is this common?
No. I mean, by far the more common version is the chronic plaque psoriasis. This is different, yeah, and
Will this go away, or am I stuck like this for life?
No. We will get rid of this for you. Don't worry. It's gonna be better than it is. This is not satisfactory for me or you.
Anna, this was the girl in Kebab. Who is she? The same one that you just spoke to. What she want now? The same thing she's arguing about.
Same question, Ella, same question. The answer doesn't change.
Yeah, it's called back. Yeah. Which day did I last come to the surgery?
That might have been the dad, you know, that phone, because the dad sounds like a woman.
No, the daughter.
The dad's got
She's
a
very
woman.
rude. It's a rude family.
Because one time, out of courtesy, I phoned them about Dr. Parker's appointments, and he went on and on and on and on and on and
St. John's Medical Centre, honey, how?
I phoned man twice, Colin.
I mean, psoriasis if we're treating it correctly, it improves, but it doesn't improve like in a week. It takes like 4 or 5 weeks of sustained treatment, which is
That's what I heard. It
things
would
to
take
improve.
5 weeks. That's what the hospital told me. 5 to 6 weeks.
The one thing that I would add in, which you haven't had yet, is a steroid. And I think that would really help with the soreness and the redness.
Okay.
As hopefully the sun comes out a bit more, and we will encourage you to get out in the sunlight a bit more as well, because sunlight helps to improve this as well.
What about sunbed? I've never used it before, but I jump on it and that to get rid of it. Well, I'm serious. I don't need to use it, but I jump on it if it gets rid of this.
Yeah, it probably would.
Probably would.
It would probably help. Yeah. That's not to say go mad on sunbeds.
No, I wouldn't go mad. I don't need to go mad. I've got an all-year-round tan. It never peels, never fades. But this is annoying me because I don't suffer from no allergies.
We will see what happens over the next couple of weeks. Like I said, if you feel it's getting worse, just come back and we'll get you seen by the skin specialists.
Okay then.
Great. And yeah, I mean, ultimately come back to, the stress that triggered it all off. I mean, is your mum, the loss of your mum, is that something that you think you would like help with at some point? Or?
To be honest, I do security. I do between 60, maybe 80 hours a week. I physically ain't got time.
You ain't got time.
Yeah.
Life's in the way.
But I'm all right. And I know my mum would want me to be strong.
Really fill your boots. Go. Keep going, keep going, keep going, keep going, keep going. Keep going, keep going, keep going. Keep going, keep going, keep going, keep going, keep going. Stop.
Hello, sir.
How are you?
I'm good. How are you?
I'm all right.
Last time we met, you were due to go back and speak to the surgeons about the operation for your colitis. Any further thoughts about whether you would consider the surgery?
I don't want to have a surgery. I don't want... they want to take all of my bowel out.
I know.
Which is wrong, I don't want to be, abnormal person. This is better if I go with my sickness and die one time. That's good, yeah. But I don't want to look, someone who is abnormal, to have a bags every time. I don't want it. I hope that I will get better or die,
Think about it this way.
I will.
If you have an operation, you don't have to worry about being up 5-6 times a night, always needing to be near a toilet, constant blood, and the diarrhea. All of these experts, they're pointing towards the same thing. Yes, you will have a bag, but in day-to-day life, that's something that you'll become accustomed to.
I know only what you think, but still I believe that I will get something before that.
What do you mean?
Or some technology will come, or it comes by itself. So maybe it will go by itself.
That's a very optimistic point of view. However, we haven't seen any miracles yet. There are no cures. This has been the standard management for many years.
I will think about it. Let me think about it. Let me see. Yes, it has not any other option. Then, of course, I will go. But let me. Yeah. Let me think a little.
Would it be possible to see a doctor today? It's a bit serious. I found some blood in the urine.
Okay.
It's a bit worrying,
How are you feeling today?
When I'm lying and I keep tossing and turning in the bed because of the pain, the bandage just go down, you know what I mean? And sometimes when it goes down, it gets tight down the bottom.
Is it painful still down here?
To be honest with you, it's painful from the stump of the big to go around. God.
I've injured my foot. I went quite a long walk on Saturday, and I think the boots are rubbing on this big toe. It was a massive blister.
Let's have a look at it. What I think we'll do, because It's a hot, sweaty area.
Yeah.
You've got an open wound. There's a huge potential for germs to get in.
Right.
And what concerns me is if there is a bit of redness,
Yeah.
is this the first signs of an infection?
So what I'm going to do, Mr. Phillips, this bit over here, just going to put a bit of Inodine on that, OK?
Twice a day,
Yeah.
you put that foot in hot, soapy water, not too hot, so you wash it really thoroughly.
Yes.
Then you dab it dry, or use a hairdryer to dry it.
Yes, yeah.
So that it's completely dry.
Yeah.
And then you put the antibiotic cream that I'm
Yes.
going to give you, and then you can cover it with a suitable, appropriate plaster.
Okay.
You OK?
Yeah, come on.
This is just on lightly, OK? There you go. You feeling OK?
I'll never feel okay, really, will I? Ah.
Doesn't hurt there?
No.
Doesn't hurt?
Could you do me a wee?
Now?
Yes. No time like the present.
My name is Dee. And
Nice meeting you, Dee.
And you too. Now, this is just a health check, very basic health check, OK?
OK.
If you have any medical problems, then it would be a GP that you make an appointment with, OK?
Yeah.
So where have you moved from?
From Greece.
Straight to London?
Straight to London.
Oh, how long have you been here?
About 4 months.
What do you think?
I love it.
Do you?
Yeah, I love English people in London.
What made you decide to come and live?
Here, it's so big. Your country is so big, and there are many opportunities.
Yeah,
and
true.
the thing is that you are organized.
Do you think so?
Yeah, I like organized countries.
I've had an awful lot of trouble with this printer here. Just don't seem to be able to get it to work.
So what's wrong with this? Oh my God! Oh,
You don't know how to use none of the equipment them in here.
Yeah, no, you
and
have to
all you girls.
Sure.
You trying to hide? Huh? You trying to hide from me?
Come and have a seat. Hello. How are you these days?
Oh, well, most things are fine.
Yes.
Same old, same old. My sleep
Oh.
is terrible, and I've not had a good night's sleep for a couple of years.
You've got to a sort of certain age now.
Oh, God, yeah.
Do you think the menopause has got anything to do with this?
Oh, yes, I do.
Are you
But
getting
I think
hot
I did.
flushes?
I was.
Sometimes it helps, to cope with the lack of sleep, to have what we call some talking therapy.
Yeah.
We've got some superb counsellors, if only just to sort of help focus on how you feel and how you can cope when you haven't got any energy and
Yes, all the
you can't
time.
get through work.
All the time.
If up here is not at peace with the world,
Yeah.
how can you expect to get a good night's sleep?
Yeah.
OK, well, have a think about it.
Right.
But let me put this to you. We're not superhuman, and just sometimes we need something to kickstart us into feeling better.
Yes. Yes.
I've known you long enough to know that actually you have been coming to me with this problem.
Yes.
And perhaps now's the time to try different tacks.
Yes.
How does it affect you? Like, are you aware of it? Are you conscious about it, or does it not bother you?
Doesn't bother me.
Doesn't bother you. Okay, good. I don't know. Did my colleague tell you it's called pityriasis alba?
Yes.
Yeah. This type of pityriasis alba, unfortunately, There's nothing that we really know kind of makes it better or worse.
Maybe antibiotic, maybe.
It's not anything to do with a bacteria or an infection or anything like that. It's getting better, and hopefully at some point it will be gone. What I will do, I'll give you a tiny little bit of hydrocortisone, 1%.
Okay.
And you can put it just on these patches around there, not around the eye because the eye is very thin, but just for 3 days, just once a day, just for 3 days, and then don't use it again, and just see if that makes any difference. Some people say it does. Any other questions? Is there anything that's worrying you at all?
Anything question? Just put it. Soak. No.
Are you interested in anything to do with those leaflets? Your mum will be even more worried.
I need them.
Do you?
I want to read it.
Are you just reading out those for interest, or is there something you want to talk to me about?
No.
You sure?
Mm-hmm.
All right, okay. Well, the door's always open if you ever want to come back and talk to me about anything from my broad selection of information
young
leaflets.
for know about that?
Yeah, I think so. I think so.
You'd be surprised how frequently patients will come in and they won't actually tell their doctor why they're there, and it's really important that we know about that, and we do have a term for it. It's called the hidden agenda. Essentially, your main tool for everything is listening, and there will always be cues.
So you basically just tick that box and hand it in. They'll put tell us off and just hand it in. Okay, when you need another one.
Also, the body language. If someone looks uneasy or they're avoiding eye contact, you just pick up on things.
Nice meeting you.
Thank you.
Take care.
Bye.
Do you want to talk to me about it?
No, I just need it.
Can you just give me 1 second? I'm going to ask your mum. Do you mind if I have a chat with you alone for 1 second? Without your mum, would that be all right? Do you mind if I just have a quick chat with Semi-Solo alone, just for 5 minutes?
Okay.
Yeah?
It's really important that young people and children feel able to speak openly to their GP, and sometimes that'll be about things that they certainly wouldn't want to speak openly about with their parents, for example. And I think it is important sometimes, even if someone is, say, under the age of 16, to have a moment of privacy.
So, the ones you were looking at were these two. What was it that made you think that you might need some of these?
I don't need them. I just need to get something. I can't reach it.
What do you mean get something?
I dropped something.
Whereabouts?
The heater.
And you want one of these?
I need to get it. I've dropped my 50 pin. I need to get it.
Okay, so you don't need anything, you don't know what these are all about, and you don't think you need what these
Just grab them.
are? All right, okay. But obviously, yes, sometimes our intuition isn't spot on.
Well, you know what? I'd rather you didn't use my information leaflets to get your 50p. Maybe try a ruler. Do you have a ruler at school?
Yes.
Maybe use your school ruler or something like that.
No, it's it.
Would that work?
Yes.
All right. By all means, have that. Okay? Take care.
Bye.
Cheers. Nothing to worry about, okay? Take care.
Oh dear.
All right.
Friday.
Has she offered any explanation as to why she's, 25 minutes late? 25 minutes late. I mean, I'll see her. It's fine. Okay, bye.
Think about your body a bit like a car. It's got to be looked after. It's going to go wrong from time to time, so you take it to the garage.
For people with those symptoms, we'd normally examine your back passage. Okay. Have you ever had that done before?
Where are you talking about? Is it the skin, the vagina?
Right there. Like a little paper split.
Okay.
Who was it who you hit?
My friend, the security guard. He does that thing.
Yeah.
And he doesn't want to climb and kill her.
is that Jones?
At 10:30, Dr. Opong. Opong. O-P-O-N-G.
Okay, bye. What can I do for you today?
Right, I don't know how it's happened, but I've cut myself underneath and my testicles are really, really swollen.
Okay.
Yeah, it's very, very uncomfortable. I sleep in the nod, yeah. I don't know, maybe there was something in the bed that I didn't realise was in there, I don't know, but it's very, really, really sore. The wife's obviously put some cream around there, but the pain's really, I can't bear the pain anymore.
Swollen and sore, and is the pain constant or do you get sudden jolts of pain? Describe that to me.
Constant.
An aching pain?
I wouldn't say an aching pain. I feel that I'm going to pass out.
Tell me about when you go for a wee.
It's very uncomfortable when I go to the toilet.
Around your groin or the testicles or the penis?
No, the penis and the testicles.
And is it a burning?
It's like a burning pain, but a sharp pain. It's like someone's poking me with something.
All right. What we'll do is we'll examine you and get you to do a urine sample. Do you think you could go to the loo?
Yeah, of course I can.
Is it tender at all?
So you say you're having bubbling urine?
Yeah.
Ciao, my name's Brian. I'm very well, thank you. What can I do to help you today, then?
Right, I'm starting to be a bit irate, right? I've had a confrontation on Thursday. I filled him in, right? I punched him in the face, and that's made me scared because I'm not dangerous like that, right? As you know, and you got it on your record.
Who was it who you hit?
My friend, who's a security guard. I'm trying to calm down.
Yeah.
Because it's all my nervous system, from my fingers here to my toes, and especially my head. It's like it's on fire inside and all that. You know what I mean?
So let me just check that I've understood this right, Brian. Yeah. So at the moment you're finding that you're feeling a lot more tense and angry at the moment at the world.
Very angry, that's right.
And you have this tendency to lash out at people when you're feeling that way.
It's mainly frustration, that's right. That's what is causing it mainly.
Okay.
Because
Do you think that mentally you're not coping as well at the moment for some reason? Because ordinarily it's not in your nature to get this angry and hurt people. No. So is something making it a bit harder for you to tolerate people at the moment?
Yeah, that's right, because...
And what do you think that is?
It's because Cameron and what he's doing, really, and all these idiots he's got around him, you know, it's really annoying me. And my mobile phone company, they know I'm blind and all that. They keep sending me text messages and I can't read them.
Not particularly useful, no.
So I find that's taking the piss out of my disability, you know. You know, and that's it. That's upsetting.
Yeah.
And he doesn't want to grab them and kill the.
The NHS computer system is absolute crap. I can't get into my computer. It doesn't like my...
No, that's your what you go on at the beginning, isn't it?
Yes, well, that's what I was trying to get in on that.
That's not that one.
Yes, it is. I can't understand starting late.
Now it's doing it. That's your card code.
That's the number I always do.
Yeah, so you're going into it now.
No, we're not. Not yet. Don't be so optimistic. You're not in until you're in, Chris.
All right, so... Yeah, you are swollen, aren't you? OK. I'm just going to lift up to see underneath. Where was the cut you saw?
Just about here, I think it is. Yeah, right there. Ooh.
Let's get you seated again.
What do you think it is, Doctor?
I think there's probably an infection in your testicles. There's a little bit of blood in your urine, which might be an indicator of infection. So 2 weeks of antibiotics, then you'll see Dr. Ferdinand.
Right.
Obviously, if things get worse in the interim, come back sooner.
Yeah.
Once this infection has settled, we can bring you back and then have a proper examination to make sure there aren't any lumps and bumps that shouldn't be there.
Yeah.
OK, that's your prescription. So let's just see how you get on.
Yep, that's absolutely fine, Doctor.
OK.
OK, then.
All
Thank
right.
you very much.
Mind how you go.
Cheers.
Bye-bye.
Don't touch anything.
No, not until I can see it on the page.
You're in.
No, it's not yet.
It is.
Not yet. Wait.
It's in. Why does it do it? I don't know. It hasn't done it for me.
So how are you going to bring yourself down to help you calm down a bit and relax a little bit
Well,
more?
that's why I've come to see you, really.
Yes.
We need something to sedate me or, not to put me out like that,
Yes.
But something milder, if you like,
I was just looking at your medications in the past.
Yeah.
And back in 2011, you took a Lanzapine for a period of time. That's a tablet we sometimes use to calm people down.
Maybe a tablet like that would help, would it?
I wonder. I'm not sure I want to use that now.
With regards to mental health, obviously there are medications which we can use, but I think they are not always the best and first thing which should be turned to. And there are other things that can be done, such as counselling, other therapies, good lifestyle choices like eating well, exercise. These are all things that can have a really positive impact on mental health.
It's frightening, really, in one sense. I don't want to be a nuisance to you and the public. I don't want no convictions or no violence at all in my life. I don't want to shoot someone, like my doctor or anybody.
Well, yes. Say ah for me.
Wide as you can. Say ah. Okay. Say ah.
Look at me.
Say ah.
Ah. Good.
Say ah for me.
Look up for Daddy. Show him the back of your eye. Say ah. Ah. Roar again. Say ah.
Okay. Say ah again. Okay. How are you sleeping at the moment?
Sleeping. I normally go to bed about 3 o'clock. So I'm getting about a couple of 3 hours at night, and that's about it, really.
What's keeping you up till 3 in the morning?
Well, all I'm doing is watching the telly.
Telly's rubbish after midnight, eh?
The TV and all that is a voice, So I feel comfort from it.
Would you say you feel lonely?
No.
No?
No, I'm not lonely, no.
No?
I like my own space.
Okay.
And I like to be on my own.
So you're happy in that respect?
Oh, in that respect, I'm really happy and all that.
In 2010, when you were feeling quite low, you were hurting yourself. How did you harm yourself back in 2010? Do you remember?
Get my knife from the kitchen.
Yeah.
And cutting.
You were cutting your arm.
Cutting my wrist.
Right.
And all that up here.
You're not thinking about doing
And your knees.
You're not thinking.
And your knees.
Right.
And stabbing the knife in your leg.
Right.
And saying, here, feel that, you twat, feel this, and all this, which is dangerous and self-harm.
Yeah.
Right, which you shouldn't be doing.
Are you doing anything like that at the moment to yourself? You're not harming yourself?
No, I'm not cutting my arms or putting marks on me.
Do you think it would be worthwhile speaking to someone about how you're feeling at the moment and about these feelings of frustration and anger you're feeling?
Yes, I think that'd be great.
Okay. I can arrange that. I can do that by referring you somewhere called Southbrook Road. They're the Community Mental Health Trust.
Oh, you don't have to be a mental to go there.
God, no. The vast majority of the people who go there actually enjoy pretty good mental health. It's just sometimes some people need a little bit of help.
Yeah.
Nothing wrong with that.
Okay.
Okay.
Well done, mate. It's all good,
Indeed. All right, let's help you gather your things up. Right, Brian.
Thank you very much.
All the best. You're going to be okay finding your way out?
Yeah.
Good. Take care.
Thank you very much.
Bye-bye.
can I help you today?
It's got a bit of a lump under my chin. You can have a go on it if you want, it's just there.
To me, it doesn't feel like anything sinister.
Cool, thank you.
Come and have a seat. How are you?
Okay.
Okay.
Fine. I feel fine in myself, yeah.
We had some results to go through. Is this why you've come?
Yes.
I hope so. Yes. I tested you for diabetes. No signs of that. Blood count, no anemia. Kidney function, fine. Cholesterol level, no. It's 6.7. The upper end of normal should be 5.
Okay.
It's a measure of the sort of fat that's floating around in your body, and we get excited about it because we know it's one of the big risk factors, fat and blood pressure and smoking, for heart disease. I suppose the first thing to say is, what's your diet like? Vegetables.
Yeah.
Vegetables and fish.
Vegetables and cakes.
Got to have some naughty days. You can't say no to cakes completely. But actually, cakes are what we call quick fixes. You get a sudden burst of sugar, but it doesn't last. If you were to take your carbohydrates in the form of something like, say, porridge in the morning, that'll keep you going because it's releasing the sugar slowly. So porridge, cereals, pasta, they're all releasing their sugars slowly.
If only there was a magic potion or something for weight, eh?
Yes, there's no magic wonders for weight. But diet, losing weight and exercise can actually reduce your cholesterol levels.
Yeah, I know exactly what I should and shouldn't be doing, so
Yeah.
I'll give it a go and I'll try.
Give it a go. You can actually get 12 weeks of free Weight Watchers. Just think about it.
Yeah, definitely. I can see you.
Okay?
Okay, meet you soon.
Good, bye-bye. I hope she does something about it.
All right, so that's 5 o'clock then. Okay, thank you. Bye-bye.
I've got my thing tonight, you know. My Weight Watchers start tonight.
Excuse me, please.
This is my area. I can't breathe.
That's why you go Weight Watchers.
Oh, leave me.
And my stomach, yes, most times there's pain in me. Yeah.
Do you get any feeling like being sick, vomiting?
No, I just feel pain. I'm feeling pain.
How's your weight been?
My weight is all right.
Yeah. And how about your appetite?
Yeah, it's okay.
Any diarrhea?
No. Blood coming out sometimes.
Blood?
Yeah.
Is it in the toilet bowl, the blood?
No.
So it's only when you're wiping?
Yeah.
Because of the symptoms you're having, would it be okay for me to examine you?
Yeah.
So I need to check your stomach.
Yeah.
The other thing is because you're having bleeding from your back passage.
Yeah.
For people with those symptoms, we'd normally examine your back passage. Okay. Have you ever had that done before?
No.
Okay. Now I'd need to take a look at your back passage. And obviously I'd have some gloves on. And then using some gel, I would examine your back passage with my finger.
No problem.
Okay. Are you okay for me to do that?
That's fine.
Do you want a chaperone? Are you happy for me to go ahead? Do you want someone to chaperone while I do that exam?
Yeah.
No, do you want someone to be in the room whilst I do that exam?
That's all right.
Okay, so first I'm just going to take a look at your stomach.
Okay.
For all intimate examinations, we would offer a chaperone to people. Because quite often your patients might come to the practice with a range of different symptoms and they wouldn't expect to do a personal exam because that's maybe not what they had in their mind. So I'm just going to gently press. Just a sec. Lie on your left-hand side, yeah? And then let me know when you're ready.
I have to take my trousers off, yeah?
Well, you can just lower them just so I can see your back passage, essentially. Tuck your knees up towards your chest. I wouldn't say it's difficult to do an intimate examination because it's something that you do throughout your training, so you do get used to doing intimate examinations. And that's why it's important that you're reassuring the patient that this is actually quite a normal thing and there's no need to feel awkward about it. Okay, so I'm just applying some jelly to your bottom end. It'll feel quite cold. And now I'm just gently advancing my finger through.
Yes.
Okay, so if you want to get dressed and then come back outside.
I don't know what's causing that blood sometimes.
You've got a pile, which is what's causing the bleeding. Have you heard that term before, hemorrhoid?
That's what I was thinking.
Okay, so around your bottom end, you've got quite a lot of veins there. They carry blood, essentially. So sometimes when people get symptoms of, say, constipation, as such, have you felt constipated yourself?
Yeah.
You have been? Okay. So I can give you symptoms of bleeding. So there are different things you can do to try and help those symptoms.
Yeah.
One thing is eating more fibre in your diet. There are some creams that I can prescribe for you that you could apply to your back passage to try and help those symptoms as well.
Okay.
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 Yeah.
Hello, this is Dr. Ferdinand calling from St John's Medical Centre. You know, we took a couple of urine samples from you last week. They came back negative for chlamydia and gonorrhea, so there was no evidence of those.
I can't sit here and tell you that you definitely don't have prostate cancer, but at the same time, you're within normal range now, which is fantastic. You brought that right down.
They did a lot of random biopsies, and your IBS-like symptoms are just IBS. They're not colon cancer.
That's fantastic news. Thank you. Thank you.
We're in business.
Yeah, it's normal. Okay, thanks. Bye. It's normal. Your chest X-ray is normal.
So, last time I saw you, you had this problem with your toe.
That's right. And I went.
And I was a bit worried about it. I asked you to get some blood tests to check for diabetes. And I'm sorry to tell you today that your blood sugar results did come back very high.
Very high. Oh,
okay?
Yeah.
So
it's looking like diabetes.
I'm afraid so. In fact, I'm certain you have diabetes. Diabetes is a serious diagnosis because it's such a wide-ranging condition. The fact that the sugars affect your eyes, affect your kidneys, and diabetes is in itself a risk factor for heart disease.
Right.
Yeah, it's not something to be taken lightly, but at the same time, at the age of 60, we've got lots of years, hopefully, to get in control of things.
Type 1 diabetes is a failure of the body to produce insulin, which is a hormone that regulates your blood sugar levels. And type 2 diabetes is a resistance to insulin. So the insulin that you do produce doesn't have the same effect. Undoubtedly, type 2 diabetes is a serious diagnosis, but there aren't many conditions where the patient themselves has so much control over how things will progress and reduce the chances of serious things happening massively.
Now, the way we go about treating that is, first of all, we give some tablets. Probably the biggest thing is the things you do in your lifestyle, so diet is absolutely key.
Yes. Plus, I'm a drinker, so will that be knocked on the head or?
What do you drink?
Mainly lager.
Okay, I was worried you were going to say that. So, I mean, alcohol in general isn't going to help you.
No, of course not.
But all these alcohols have high sugar content, especially a pint of lager.
I thought that,
Okay.
I can still work though, can't I?
What do you do for a living?
I work on the construction sites.
Yeah, so...
Because that's my living, I need to get money.
Yeah, having diabetes is not going to stop you from being able to work on the site.
Yeah.
But you need to also be aware of just what's happening with your blood sugars, because we're talking about the rest of your life, 30 odd years. We need to get this diabetes under control, and that will take you time to manage your diet and to figure out what's bad, what's good. Actually, that's all you need from me in terms of paperwork for now. I'll give you a prescription now as well.
Right.
We might need a couple of different tablets to get your sugars under control.
Do your fist for me.
Now I've got to pinch an inch. All right? Keep your belly nice and relaxed, okay? Very good.
All right, sharp scratch.
Right. Any allergies to anything that you're aware of?
No.
High blood pressure?
No.
High cholesterol?
No.
Thrombosis, clots in the legs or the lungs?
No.
Diabetes?
No.
Glaucoma?
No.
And breast cancer? No. Have you ever had HIV screening?
I think I did, but it was years ago.
Right. Do you want me to do it today?
Yeah.
Yeah? Let me feel your hands. Are you warm? So this is an instant result.
All right.
1 dot is negative and 2 would be positive.
When I had my eyes tested and he's in there saying to me, well, you could do with losing weight. I said, mate, I'm 66.
Yeah, oh no. Can't be doing that.
Donuts. Mate, no. Nice to see you anyway.
And you haven't seen you for a long time.
I don't come here a lot, do I?
I don't blame you. Take care. See you soon. Bye.
There you go, you've got a nice negative dot there.
Phew.
It's amazing how many people suddenly think when you say to them, oh, it's a test, you can have the results straight away, they go, oh, OK. What, you mean now? What about chlamydia screening? Have you had chlamydia screening recently?
Not recently.
Do you want to do that as well? You can do that yourself.
Okay.
What you do for that is you just go to the toilet, wipe yourself, pop that much into the vagina, woohoo, and then in the pot.
Okay.
All right, and the toilet's right opposite.
Hi, is it Miss Strong? Hi, please come in. What can I do for you?
I'm here about my coil.
Okay.
I've had in over 5 years.
Okay. Were you hoping to have it taken out today?
No, I want to keep it in.
Oh, right, okay.
If I can.
Fine. I think, to be honest with you, if you've had it in for 5 years, it's better to come out.
I've been fine with it. I've had...
Fine. I mean, the last set of blood tests that they did suggested that you might be postmenopausal now, and at 53, I would expect that to be the case. So, as in, your periods might have stopped now. So, rather than leave this in for a long period of time, more than the recommended time frame, my gut instinct is it should probably come out.
You think I've had the menopause?
That's what the blood test would indicate.
I haven't got no hot flushes or anything.
Not everyone does get hot flushes. Not everyone finds it difficult, but that's some people. Yeah, the menopause affects people in various different ways.
The hot flushes, I'm not really too bad on that. I might get the one maybe a month, if that.
Yeah, no, I don't get the hot flushes.
So I don't get the hot flushes really and truly. I don't experience that. But what I've noticed with myself is that I'm so snappy.
Yeah, me too.
Bad-tempered.
Yeah, me too. Yeah.
It's like I want to kill anyone who gets... It's not even funny because it's like I have to check myself sometimes.
Yeah,
do you know what I mean?
Of course. It's not because somebody will say to you, why did you do that? And you think, did I?
Don't know
that you did.
It's got to be menopausal.
Yeah.
Was there anything else you wanted to ask about? Was that it today?
What's this like? I know it's like having, my vagina in there. You know that bridge bit, it keeps splitting now and again.
Okay.
Like a paper tear.
What? Rough drawing, where are you talking about? Is it the back passage or is it actually the skin of the vagina?
Right on the muscle bit in the middle there. Like a little paper split.
Okay. And does it bleed?
No.
Is it just very sore?
Mm.
Okay. Well, that might all correlate to the fact that you might be postmenopausal now. You can get vaginal atrophy postmenopausally, where because you don't have the estrogen going around, the vagina will actually get a bit dry and actually can shrink, and can get problems there. So I think this is all kind of part and parcel of the same picture, really. My gut instinct is that we take the coil out, we can start giving you some estrogen cream for the vagina that should keep it supple and avoid getting further kind of tears or irritation, things like that.
Yeah.
Does that make sense?
Yeah.
All right.
How are you?
Not good, doctor. I keep feeling terribly sick, nauseous, and then I get a cold sweat, and then I get a terrible pain across the top of my eye here, just on the one side. The pain don't go away. I've tried every tablet, and it's even to touch it, it's sensitive.
OK. So when did this start?
I've had it for a couple of weeks now. It's continuously coming and going.
And how would you describe the pain?
It's like a toothache in my head. If you touch it even there, it's so sensitive.
Yes, so it's the pain that you can make worse by touching it.
Just by touching it.
Right, may I check your blood pressure, please?
Yes. Do you know what it is, doctor?
Well, I think it's a migraine.
Oh, sugar, I've never had them before.
Is there anything else going on in your life that you...
I'm just down all the time, constantly. And I'm going today to, what do you call the people, the psychologists?
Yes. Are you worrying about that?
It seems strange, do you know? I don't know.
What's your biggest fear?
I just feel that it makes me inadequate if I'm attending something like that. Do you know what I mean? I feel a bit worthless and a bit silly.
OK. We could look at it a different way round, though, couldn't we? Think about your body a bit like a car that has to be serviced, it's got to be looked after, it's going to go wrong from time to time.
Yeah, true.
So you take it to the garage.
Yeah,
and the garage has a look, has to do some tests. And then they'll come and tell you, they say, well, look, actually, there's nothing really seriously wrong, it's just a little bit of a loose this, that or the other. Or they might say, unfortunately, there's lots wrong and you're going to need to buy a new engine or whatever.
Yeah.
It's hard to imagine the rest of the body behaving normally if up here is in a turmoil.
Yeah, I feel low and down sometimes, and I think...
Yes.
Well...
And I think that that's one of the reasons we thought you might want to try an antidepressant.
Yeah.
Stress and depression are the bread and butter of our work. Very common indeed. And stress can be very important in many different illnesses. If I'm looking at a condition that somebody has, I might say, yes, this is the physical condition that they have, but what about the psychological element that could be making it worse?
You know, this headache, this migraine, if you like, it's the way your body is showing that it's under stress. But what we've got to try and address is what's causing it in the first
underlying
place.
thing, yeah. It's just been everything.
Just keep talking to yourself and say, look, I haven't got anything to worry about at the moment because we don't know the facts.
Yeah.
So put that bit of anxiety in an envelope.
Seal it up.
And seal it up. OK? And concentrate on what is working well. I can do this, I can do that.
I mean, I feel quite fit, do you know what I mean? And I
yes.
think, well, I'm going to be 69 this year and I still feel quite good. Do you
Absolutely.
Know what I mean?
Keep on with that.
Whatever I'm doing quite right.
And try to just sort of enjoy what you're doing.
Yeah.
Try to wallow in the good things in life.
I've got to try and fill every day with something that's going to be beneficial to me, even just going for a walk.
You've got to do things that are going to make you happy and that you enjoy.
Yeah. Not bar of chocolate.
Yes, what a good idea.
Yeah.
Now, can you keep still and let me do your blood pressure, do you think? Oh, yes, I mean, this is definitely stress, isn't it? Right. These little tablets you take for the sick feeling, right?
Yeah.
And I'm proposing we give you the slightly stronger cocodamol to take, right? I hope you feel a bit better sooner, and I hope it's helped to have a little chat about things.
Thank you, Jan. I'll make an appointment next week to see if these have helped me as well.
Yes.
Thank you very much.
OK, bye.
Bye-bye.
How are you today, sir? You're feeling particularly low at the moment.
How have you been in yourself?
I'm trying to cope, but still, because it's still the same.
Is it hard?
Sometimes.
Yeah.
Yeah, sometimes.
What's happened recently to make this the worst day of your life? Okay. Well, look, I'm booking you in for an appointment at 3:40. You're not a hypochondriac. Take care. Bye-bye.
Now, he can be a bit squiffy for a few days with this, all right? So if he's a bit loose, don't worry.
You've got such a hard life.
Oh. Right, so sit him like that, nice and relaxed, yeah?
Yes.
Okay.
I'm trying to be.
Oh, you're doing very well.
Right, I'm not going to look. So
No,
tell me
just
when you're doing it.
relax, just relax, okay? He's going to...
My heart is beating.
It's all right. All right. You're doing well, you're doing well. So, there you go. It's all done, look, see? Oh. When somebody wants me to hold their baby for them, I can feel just as nervous.
Okay, have you got some tissue, please?
Yes, Oi, mister. I'll get away with you.
Alright, Mummy's sorry.
4 weeks' time.
What's he got to get done then?
He has his second diphtheria, tetanus, and his meningitis C. And he has.
Injection?
Yeah.
Gosh, I can't do it.
Look, he's all right now. He's just whinging now. You're fine. Man up. Come here, give us a cuddle. What you like? What you like? Hey? I've always been able to communicate with children. You see them evolve, and one child, she wouldn't even come in the door. She'd sit in her buggy at the door, and I'd say to her mum, just leave the door open, that's fine, she can stay there if she doesn't want to come in. And then the next time she came in and she stayed in the buggy. And then I've met that child all the way through, and now she's an adult working, and I still bump into her, and we get on really well, and I've seen her develop as a child into a young woman, and it's great. Right, what time do you want? 9:30?
That's perfect.
Are you all right there, your hand down my cleavage, mister? My dog does that.
He does that all the time. It doesn't matter who it is, he does it.
You've got to let them develop. And that's what I love. I think they're so funny.
Thank you.
Are we going to get a smile before you go so your mummy knows you're all right? Look, he's fine now.
Did you have a problem with your medication? Uh-huh. Okay. Okay, you're welcome. Take care, bye.
Hello?
I'm still limping.
You're still limping, Ian?
Yeah.
Is it no better at all then?
No, it's not gone down at all with it. They phoned me up this morning saying, can I come back to work today?
No, you can't come back to work.
They want me back this morning.
They wanted you back?
Yeah.
I mean... Hello. So, you mentioned the lump.
Yeah.
Let me see it. So whereabouts do you feel your pain?
It's around there.
It's around there?
Yeah.
OK. It's been a little over 2 weeks now, and the pain's no better at all. If you come lie down, I can work out whether it's your hip or your knee that's causing the problem. Right. So, bend your knee for me. Hang on. Relax. Just relax. Let me move your knee. Can you bend your hip a bit more as well?
No.
Does your hip come up any higher?
No, that's how high it comes up.
That's as high as it goes. All right. Does that hurt?
Yeah.
Can you sit? Can you sit on the edge of the couch? Might be easier if we get you to sit. Great. That's all right. Just. Oh, does that hurt? Sorry. Yeah. Let's get you up. Sorry.
That's all right.
Didn't mean to cause you discomfort. I think the problem's your hip, because your knee seems to be moving quite well.
Yeah.
And it's your hip that's actually really struggling to get much movement out of.
Yeah.
Would you agree with that? Or?
Yeah.
I think maybe we should get you referred to see the specialist about your knee and your hip. All right, Ian. Yeah, do you want a tissue? I take it you're not too keen on the idea of having to have further operations?
Oh, I'll be all right. Last time they said it was 50-50.
Hello, it's Dr. Parker here at St John's Medical Centre. Right, he said he did want to have counselling, and I genuinely believe he hasn't been taking crack since then. He still takes cannabis, but then a third of the people that live around this surgery take cannabis, so that's nothing new.
OK, but it's really important you try and avoid the marijuana. The strong stuff or the weaker stuff, it's still best to try and avoid altogether. OK, take care. Cheers, bye-bye.
If you want to try to avoid an operation, then the thing to do instead would be to have some physio and seeing if that helps. But unfortunately, arthritis tends to be progressive. It tends to get worse with time anyway. So, I mean, would you like to try some physio first, or do you want to be referred for...
I don't mind being referred to see the doctor again.
You'll see the doctor about maybe having the operation?
Yeah. Can I go back to work yet? Or not?
At the moment, do you think you'd be able to manage the pain?
No. They wanted me back this morning.
I know. Maybe if we give you a couple of weeks more off, and that gives enough time for hopefully the knee and the hip to settle down a bit more.
They want it straight away, they said. They won't get paid otherwise.
We'll take that then, quick. So that covers you from the 10th up until the 24th.
Yeah.
Yeah, I'll get the paperwork sent off. I'll ask them to see you as soon as possible. Okay?
Yeah. Bye-bye.
Bye-bye. Take care.
See you later.
Bye.
Mr. Tappenden, hi there. What can I do for you today?
Yeah, basically what it is, look, I'm a diabetic, so my levels have been quite high, and I think I might have a urine infection.
All right. How high is high on your sugars right now?
22.3.
Okay. And where do you normally sort of run at?
Well, normally they run at about 5 or 6. I mean.
Yeah. So they really have shot up.
Yeah.
You've had quite a few urine infections. Is that right?
Yeah, on and off. Yeah.
Okay.
Yeah.
What are the symptoms you've been getting?
Just like a burning since
It burns?
Yeah.
Okay. And are you peeing more often than normal?
Yeah, more often, yeah. Just continuously all the time.
Right.
Yeah.
Okay. Have you seen any blood or anything in there?
No,
at
it's
all?
not blood.
Right.
It's not blood.
Any cough or
No.
difficulty breathing, headaches?
No.
Rash?
No.
Nothing else like that? Diarrhea?
No.
Bowel habits fine?
No.
Okay.
Yeah, they've been all right.
I think the first thing I'll do, if you don't mind, is just dip the urine.
Yeah, sure.
Wait and take it from there, okay?
Yeah.
There's a lot of glucose in your urine,
Yes, sir.
but there isn't much evidence that there's a nasty infection going on. You shouldn't really get a significant burning sensation from just sugar, but I think going to the toilet a lot, going to the toilet very often, is classic of your blood sugar not being very well controlled and being much too high right now. I think we need to get your sugars better controlled, and I think that's going to mean cranking up the insulin slightly. I think we should go to 12 in the morning and 10 in the evening. And I think we should see you early next week with the results of the urine sample to make sure we haven't missed any infection. Although it doesn't, I don't think that's what's happening.
No.
All right? Okay.
Okay, yeah.
Take care.
Okay.
Nice meeting you.
So I just need to examine her.
Yeah, that's fine. Hello, cheeky.
Think of the 3 pigs and the wolf outside going, huff, puff, blow your house down. That's the house. In. Get out of it. Try again, go on.
And if you were going to score it, say, 10 being the worst pain in the world, like having your arm ripped off by a lion, and 1 being like bitten by an ant, how would you score it?
10.
This pain in your stomach is as bad as having your arm being ripped off by a lion.
Easy.
That's it. Well done. Well done.
Hello.
Yeah, please.
Jordan, this way. Jordan, no, this way.
What's up with Jordan today?
Right, I've just got a little problem. The way he's behaving, I'm just wondering, has he got some form of autism? I was reading on the internet that kids that line their toys up, line up their toys, because he does it like all
Lining
the
up the
time.
toys. Okay.
And he knows all the planets. You know, he just lined them up. Jordan, no, come this way. Jordan.
Okay.
Sit down. Okay?
What else?
And sometimes he's like this, he just laughs unconditionally. Jordan, can you stop?
And how does he get on with the other kids his age?
Fine. Teacher said he's fine. You know, Jordan, can you stop, please?
If Jordan wants something, can he tell you about it? Can he tell you, I want this book, I want that book, I want to watch this, I want to do that, I need something to eat, I need something to drink?
Yeah.
I mean, you're right, autism is a spectrum. It goes from very severe to barely noticeable, to be honest. What you described about being quite obsessive about one thing, that ritualistic behaviour of lining things up. Those are two features of autism.
Yeah.
But there's also features of normal 5-year-old kids as well. Okay. The internet has a really interesting role in healthcare. I think once people have their diagnosis, it's very easy for them to then go away and research what the treatment options are themselves, and that's great. I really welcome that. I want my patients to be really well informed about their conditions. But I think the one thing that the internet's not very good at is diagnosing. Usually if a patient has tried to diagnose themselves on the internet, I'd say 9 times out of 10, they're probably wrong. Autism is a social communication disorder. It's your inability to be able to interact and socialise with the world around you.
Yeah.
It sounds like he does fine.
Yeah.
To line up the toys, that's every kid does that. Lots of adults do that. We will line things up just because that's the way we are. It doesn't make us autistic, it just means that is a little idiosyncrasy of some people's behaviour.
Yeah.
He seems like a pretty normal
5-year-old.
to me.
Okay.
All right?
Thank you.
No problem.
Jordan, come on, time to go. Say thank you to Doctor. Thank you.
Bye-bye.
Bye.
It's time for the weekend.
Right, I've put that in for you. You're welcome. Okay, bye. Bye.
The patient was so happy that she got an appointment at the time that she wanted, but she goes, oh my God, thank you, darling, God bless you.
What are you doing this weekend?
Watching my TV with my teddy bear.